Guys, here we're getting ready for a fractional CO2 laser resurfacing. I'm administering some nerve blocks in various parts of the face so that the patient does not feel the procedure. Then I proceed to administer tumescent anesthesia for the areas that the nerve blocks cannot fully anesthetize. And so here we're using a very small cannula. We're injecting some tumescent fluid through a very small incision behind the ear. At this point, the patient is fully numb with the administration of tumescent anesthesia and the nerve blocks, and then we start our fractional laser resurfacing procedure. Here we're using the Fraxel Repair laser. The Fraxel Repair laser uses a fractional beam of the CO2 laser in contrast to the Fraxel Restore Dual, which is what most people know, and that laser uses a non-ablative beam. Here you could see the areas of frosting. These dots of the laser are the areas that have been evaporated. And so in a very methodical way, we treat the entire face. We're treating this patient for acne scars, and we're going rather deep, and that's why there's some pinpoint bleeding. This procedure has about 3 to 5 days downtime where the area is healed, and then you get brand new skin formation. Fraxel Repair, fractional CO2 laser resurfacing for treatment of acne scars.